What's going on, everybody? John Stamper, and excited to be with you, and very excited to be with Amy Morgan, who is the VP of Practice Growth Strategies at Spear Education, as well as Dr. Dan Butterman. Been practicing dentistry for 30 years. He's in Colorado, and he is faculty chair at CDocs. Amy and Dan, how are you doing today?
Great. Thank you, John. Hi, Dan. How are you?
Hi, I'm good. Doing great. How are you guys?
Doing wonderful. Well, thanks to both of you for joining. So what we want to discuss today is we want to talk a little bit about Navigator, which is an exciting product with Spear Education. You know, I share this a lot, Amy. So many people in dentistry are aware of Spear for the amazing education, you know, over the years, you know, for dentists and that. But you guys have put together some really exciting programs to help dentists move from what Spear has been known as this world-class organization with education and really into this implementation process of helping practices move forward. So I'd love to start with having you just talk a little bit about the Navigator program. And then we're going to talk to Dr. Butterman about like what his experience has been. He's early in the stage. There's been a couple of phases that he's been part of, but I'd love to have you kind of set the stage with that.
I appreciate it, John, because, you know, one of the things that I realize that is that post-COVID has brought challenges to our dental community that has never really been there before. We're still very much struggling with hiring and retention. We're still waiting for the other shoe to drop as far as economics. And that creates a scarcity mindset, which can create, a tremendous amount of stress and pressure and anxiety for both the doctors and the teams. So we realized at Spear Education that we needed to do more, that we needed to create tiers and levels of programs and solutions that would meet teams where they are, meet doctors where they are, and offer them opportunities. So Navigator is a program that's easily accessible, that can solve many, many issues. And the evaluation that Dr. Butterman went through at first just helps us take the temperature of the person in front of us to try to customize, not cookie cutter, what level of approach is really appropriate for them, because I never want there to be a barrier to reaching out for help. And I think that with many consulting and coaching programs out there, there's a lot of obstacles and barriers that we want to just rise above and beyond. So we're truly then an advocate for implementation.
Yeah. And Dr. Butterman, you know, when I think back, we're going to use this 30-year time frame that we were speaking about as far as your career in dentistry. You know, if I go from the year 2000 and back 30 years, I know a lot of things changed in dentistry. But when I think about the year 2000 to now, especially the last 5 to 10 years, it's just crazy how far dentistry has come and a lot of the changes. And I think to Amy's point, like post-COVID, you know, so many practices got through that time period and then kind of was able to take a deep breath. And now here you are. And, you know, like she mentioned, there are new challenges. So can you touch on that first? And then I want to kind of get into the specifics of Navigator and what your experience has been kind of in these early phases.
Yeah, I think that prior to COVID, it was sort of, there was always ups and downs. The cycle was fairly similar. And in all my years of practicing dentistry, it was quite a similar process on the business side. Patients were there, people were accepting treatment, some months better than others. Everything changed after COVID. And it was kind of one of those things where all of a sudden it felt like the entire workforce dropped off. And we had struggles getting patients to come back in. Once we did, our bigger struggles were trying to have employees actually show up to work. All of the work from home sort of attitude that people developed, that hybrid workflow, well, that's wonderful. In a dental practice, it just does not work. And I think that that created a lot of stress in our personal practice, I think dentistry in general, where all of a sudden the pool of applicants for jobs just dried up. And the applicants that we had may not have had the level of experience that we had seen in the past. So I think from the staffing side of things, that really created new challenges that we just hadn't seen before, trying to do more with less people.
So Amy, two things here. Number one, I would love to have you talk a little bit about these first two phases of Navigator that Dr. Butterman and his team have gone through. And then, Dan, I'd like to go through kind of not only what that experience has been like, what you've taken away from it, what you're excited about, but then more importantly, to speak to other dentists out there that are going to watch this that maybe are having some of the same challenges and they're on the fence of wanting to learn more about a program like this and how it could help them in their practice. But, I think maybe hearing it from you and kind of your reasoning could help them along that journey. So, Amy, maybe you can start with the two parts of Navigator that he had started with.
And before I even do that, I want to thank Dr. Butterman because for being a guinea pig, to not only being a guinea pig, but probably having the worst coach in the world, me, actually leading the charge. But the reason that we were so excited to work with Dr. Butterman is because, once again, with no barrier to help, here's an example of a very successful practitioner with a very successful office that still can learn new skills to take the practice to the next level. And I think that that's a good example for everyone. We're not talking about someone in crisis. We're not even talking about someone that's not growing and doesn't teach others how to grow. So the whole idea of the first phase that Doctor has experienced is that light first phase, our assessment was an easy 10-question assessment that allowed me, as the person looking for the opportunity, to string some opportunities and challenges together to immediately spot where we might be able to help this particular unicorn practice to grow. The second phase is that once we got there and clearly saw a path for opportunity, we then went into what I consider to be a comprehensive new patient exam, the discovery call, which is now that we know basically generally where we think we want to go with a practice to take it forward. The discovery phase allowed us to discover even deeper and, most importantly, to get alignment, engagement, and enthusiasm about where we're going in the process. So the assessment is just to get your foot in the door. The discovery is once the decision has been made to move forward and allow Navigator to support future growth. That's where we really roll up our sleeves and set the strategy and plan for first phase next 90 days.
And Dan, Amy talked about you being the guinea pig. But as you know, it's one thing to like raise your hand. It's a whole other thing to like open yourself up, right? And be vulnerable and want to go through this process. So can you start with the assessment and what were some of the takeaways from that were beneficial?
I will say I didn't go into this with the intent of being vulnerable. My thought was, I'm doing well. My practice is doing well. We're hitting the numbers that I felt. Let me rephrase. We're able to pay all our bills and I'm able to take home the money that I want month to month. Sure, we had some good months. We had some bad months. We had good days. We had bad days. But for the most part, I felt like things were going fine. And so what do I possibly have to lose by filling out this assessment? Everything's gonna be fine with that. But as dentists, we're always very curious also about what our neighbors are doing. We like benchmarks. We want to kind of see what the whole world around us is doing. And so I have to say that when I started answering those few questions, it really surprised me because it sort of made me think about my team, made me think about the day-to-day, not really with solutions or problems, but I gave thought to issues that just didn't even occur to me before. And so when I started filling that out, I did feel a little bit nervous, to be perfectly honest with you, because I didn't know what my assessment would say. And that was that vulnerability piece that just kind of played into it.
And then how about the second part, going through the discovery call, and then as you kind of moved along and got into that, touch on that a little bit, if you would.
Yeah. So, it was sort of interesting because once I saw my assessment score, I realized, and also just in a brief conversation with Amy, I realized that there were definitely some things that not necessarily that I was doing wrong, but that I absolutely could be doing better. All right, let's be honest. The things that if I'm going to be vulnerable, I'll be vulnerable. Things that I was absolutely doing wrong. And when you start thinking about yourself versus others, and there's this comparison that comes into play. When I saw that there were definitely some things that I could work on in my practice, and we set up that discovery call, like, I won't say I was afraid, but there was intimidation. I truly felt vulnerable in this process, simply because I thought that going through my numbers, like, I'm a guy that teaches, I talk to other dentists. I'm now opening up my practice to let somebody look into it, look under the covers to see really what is it that we do day to day. And I was worried that there would be a judgment, honestly, attached to it. And it didn't go like that at all. I think it was fascinating for me to sort of look at the successes that we have. And Amy really focused, here are the things that we're doing really well. And she kind of took it from an approach where even the things that we weren't doing as well were opportunities. And in asking about team meetings and asking about job descriptions and titles, I didn't realize that my employees have very ambiguous job titles. You think, as a hygienist, do they really need a description of their job? As an assistant, you're assisting me, you're doing dental procedures. Do you really need a description? But in actually talking through it, I very quickly learned that it's that ambiguity that team members have that really doesn't give them a benchmark to grow, to develop, to learn new skills. There is nothing to evaluate them on. And I think that was the first eye-opening piece for me, is that we have to clearly define those roles. My hygienist needs to know that these are the expectations day to day, and we're going to be looking at these, and that's what's going to affect our entire practice, as with all of my team members. And then it really comes from a leadership perspective, because if things are going well in your practice, it's almost more dangerous than when things are going badly, because if they're going badly, you seek help and you want to make a change. But when things are going well, you really don't think about it. But the point is, there were so many additional things that we could do from our team meetings, from leadership. I would come in the morning and I would just expect everybody to know their role. Here's what we're doing today. It would just be a quick conversation or no conversation at all about what we want to achieve today. But we weren't talking about benchmarks. We weren't talking about all the individual pieces that could be built into the day to make us more effective and more profitable. And it's these simple things. And that's what really surprised me with this, is because Amy didn't come in and say, hey, tomorrow we're changing your whole practice. Everything you know, everything you've done, we're throwing all of that out and we're starting over. It wasn't like that at all. It was, let's just make this one change. Let's just define what the role for your hygienist should be. Let's just talk about scheduling. And maybe scheduling isn't just even patient scheduling. Let's talk about, when are you going to schedule a team meeting? What part of the day are we going to schedule meetings with the team to go over scheduling? Like all of those components of who's going to talk to who, when is this going to happen? I just assumed scheduling meant, when do you put a patient at a particular time? But there's so much more to that. So it was that eye-opening excitement in that discovery call where at first I felt intimidated. I was worried that my practice maybe had flaws that I was unaware of. But it turned out that we are doing a lot of things right. We just could be doing a lot of things better. And just learning that in a non-threatening way was pretty eye-opening for me.
Yeah, John, if I could just say something to that, and it was really fun to take Dan and his spouse, who is his office manager, through it. Dentists are type A. You've talked to me before. I don't call them anal. We call you subgingival, to go with the dental vernacular. And the fear, that intimidation is, I have to be A plus. And there is a very real barrier to opening up and letting someone else evaluate. And so an excellent coach, an excellent navigator is going to preserve that self-worth, self-esteem, and build on it, because you're never going to start at zero. You're going to always start with a certain level of success. And the goal here is to capture that recipe for success so that you can continue to do that and then build it forward. So this is why this was such a perfect opportunity for us we're jokingly calling this our own little Spear reality show, because the truth is, any practice has opportunity for next level success, and any practice is going to have inefficiencies, and any practice is going to have those strengths. and to be able to meet that practice where they are is what creates the ability to be able to influence and create change. So I was very excited to hear how quickly that comfort level came up and how quickly we were able to get to things that would immediately decrease stress and increase efficiency to get to number 2.
So, Amy, as you know, over the years in dentistry, there have been countless numbers of programs, right, that have been designed to help dental practice owners and their teams advance and grow and all those things. Can you touch on just a little bit of what you feel like went into Navigator that, in my opinion, was kind of the pieces that would take a situation like Dan's practice where he was moving forward, he was successful, and actually have him pull back a little bit and take the time to have that awareness, like, wow, there are some things that we can be doing better to get to the next level. Is there anything in specific that you can talk about just in the design of it? I think when you talk about the Spear Reality Show, I think it's very fascinating to hear the both of you share that, this program really kind of hit something. And I'm just curious from your perspective, like, what's behind the nuts and bolts of that?
Well, it's funny that you could say it because I did try to one up Dan just a little bit he said he's been in practice for 30 years. I've been coaching for 35. So I win, but I also have lost and failed along the line. I've been in every type of consulting program in dentistry, the good old fashioned, I'm in your office, I'm disrupting for 2 days. I ride away on my white horse, just hoping that something sticks, all the way to the other end of the spectrum being so darn cookie cutter that it doesn't feel like it fits or meets the needs. And so this program that we've developed is very much evolutionary, just like dentistry is evolutionary. And what we realized is that, we don't want this to be like an addiction where you can't live without a consultant, or that you need someone else to guide to get your team to perform at a certain level. So this is self-guided with tender, loving support. And what I mean by that is that we have found, by training up the operational partners, the team leaders, to be able to truly learn to train, facilitate, action plan, and hold out for full implementation and mastery is a lot better than that outside paradigm shifter coming in, causing chaos and leaving. And so the materials are best practice. The jury's been out on that for a really long time. Best practice, foundational systems, business principles, leadership. That's something that lots of people can talk about, but not a whole bunch of people can do. So when we redesigned this to be self-guided in a way that it was an elephant bite versus the whole elephant, that people who are in the business every day, who are the ones who are living it, can confidently and competently deploy because they're supported, they've been trained, they understand the material, and they can actually make it work for their team, is a much more impactful way to approach training up a practice. And so that's, I think, what makes Navigator very unique. We're not the white horse, the individual. If you have a good relationship with your consultant, then the team's going to move forward. No, this is all about you. It's all about your practice. It's all about what Dan said, choosing your 90-day strategies wisely so that you're not boiling the ocean, and very clearly moving forward in a way that doesn't overwhelm but penetrates. That's why I'm so excited about Navigator.
So Dan, like 10 years ago, I had an opportunity to work in some dental practices, and I was tasked with just going in and identifying some opportunities. And one of the first things that I discovered was the unscheduled treatment list, right? And it kind of blew my mind when I saw like all of the treatment for a lot of the patients that, still, could be done. And so, hearing Amy talk about this and hearing about your situation, in the sense that what's, I guess, kind of cool about dentistry, let's call it like it is when you do commit to a program like this, it's not just taking like going from 1x to 3x. I feel like in dentistry, as you know, like a couple of tweaks along the way. And like you said, Amy, just kind of eating this thing one bite at a time can have big impact. I think that's kind of very exciting for all dental practices. And so Dan, I'm just curious, from your perspective, right? It's like very obvious to anybody watching this that, you were running and are running, I should say, a successful practice, but sometimes these small changes, at least in a dental, practice, can have large impact.
Oh, very much so. And just to clarify one thing, I mean, if I start doing the math, and I think that I was a pre-dental major and 4 years of dental school, maybe I need to revise that number, Amy, and I'm not 100% sure that you have more experience in dental than me. So let's just be totally clear about that. As to some of the specifics, as we start to think through this, absolutely increasing patient acceptance of cases, that's a big thing, but it doesn't even just come down to that. It's the minor things. I said, and my wife, who is my practice manager, my office manager, said that we're going to start increasing some marketing. We brought in an associate who happens to be my son. We want to start doing some marketing to bring in new patients. And the question that Amy asked me kind of blew me away. She said, well, how many new patients do you have a month? And well, that was easy. And we were able to look up and address that. And she's like, no. Not how many new patients do you have a month that are coming into your practice. How many new patients do you have a month that are reaching out to you? And what percent of those patients are you converting to new patients that actually come into your practice? And I'm like, I have no idea. And what she told me is, well, you really should not start marketing until you know that number. How are you going to evaluate if your marketing is successful? And it's those little things, it's those little pearls that make you stop and think, maybe we need to look at this from a different approach. And hiring a new team member. Okay, well, Amy said, well, what questions are you going to ask in the interview? Where are you going to look to market for this person? What sources are you going to advertise? What is your job description? What is your advertisement even going to say? That level of help as you start to move along. I mean, you call it navigator. I mean, it truly is navigating through all of these challenges, all of these parts of a practice, because there's so many. And it's not, we think about improving the practice and getting things better and certainly increasing case acceptance, certainly increasing revenue into the practice is important, but it's not just about doing more dentistry or seeing more patients. It's being as efficient as you can with the patients you have and the procedures that you have on top of it. And I think that this whole process has been eye-opening for me and making me rethink and question some of the things that we are doing. Because again, if things have been going well and you have been successful, it's hard to step back and take a look and really evaluate it. When things are going poorly, that's easier. And I would just encourage people as they start thinking about, why should I take a practice evaluation if I'm doing fine, if I'm hitting my numbers and I'm able to buy the car I want, to live in the house I want? It's just that there are so many more things you can be doing with so many minor little tweaks and minor thoughts that a good coach, that a good program can bring you, that really, and it's not even about that as well. It's the day-to-day, it's quality of life. If there are a way to reduce friction in your practice, sleep better at night, those are all intangible things. And even in the short amount of time that we've been working with Navigator and working with Amy, it's those little things that we start to see. And that's what's built just a tremendous excitement for myself and my entire team. Everybody's excited about this because, again, we're not throwing everything out and starting from scratch. We're just looking at what we have, what we're doing day to day, and we're just trying to tweak that and make that a little bit better.
Yeah, and I'm sure it feels manageable. And, I mean, I was going to ask you, I don't know when it happened. I don't even think we could pinpoint a specific year where dentistry went from being what many would look at to being a reactive type of industry to like a proactive, right? Meaning, as the both of you know so very well, that there was a time, and I think you mentioned it, Dan, where patient comes in to get their cleanings. If they're in pain, they come in or what have you. And then we all woke up one day in dentistry and it felt like for a lot of dental practices, that were humming along, you needed to kind of switch your mindset and be a little bit more proactive. And I think hearing you talk about this, Dan, it's like, it's more than just some of those boxes that were already checked. It really is like, how do you build an even stronger foundation for the future through a lot of these programs, which I think is really exciting. So what would you say, Dan, in closing? And you kind of shared it, but even just kind of like a final wrap for a dentist out there that's watching this, or a team member that's watching this, that, has been kind of leaning towards knowing that maybe this is something that they should do, but they haven't done it yet. Like, what would you say to them?
I would say, using myself as an example, one of the things that Amy said to me, which was 100% true. I'm used to speaking in front of people. I'm used to lecturing. I'm used to teaching other dentists. Talking to a patient about a treatment plan and getting case acceptance is something that I was fairly good at. And what Amy said to me is that I've been able to muscle through this process and create a successful practice by sort of pushing through some of the roadblocks. And so what she asked me was, do I have a system in place? If it wasn't me, if it was a new dentist, if it was a new team member stepping in, are all the systems in place that would allow anybody to be successful in the type of practice that you've created? And I would argue that a lot of us as dentists, we're comfortable with the job that we do and we're successful with what we do, but we really don't have those proper systems in place to make sure that anybody could step in, anybody can be successful in that type of practice. So really, in summary, I would just say that it's worth taking a look. There is no harm in filling out a 2-minute survey to just get an idea of where you are and what your practice is. Even if it only does one thing and it makes you start thinking about some of the things you can do better in your practice, that's wonderful. But taking it to that next level and having that discovery call, that kind of changes everything. So I would say, be vulnerable. That is the only way to really grow. It's the only way to take it to the next level.
So, Amy, isn't it awesome, even though the two of you kind of went back and forth in the years that he's been practicing and the years that you've kind of been doing what you're doing, that he raised his hand and he decided to open up and be a part of this? Any last thoughts from your perspective? I mean, obviously, anybody that's watching this, all the information about Navigator, you'll be able to, click on a link and learn more from the Spear Education team on how you can take advantage of this same exact process that Dan has gone through. But Amy, any last thoughts?
Yeah, I'm already a proud mama, because that's exactly the point that I want the entire community to know. There's a lot of noise out there. It is noisy. Whether we're, the day before election day, it is noisy on all levels. And with the changing of the generational guard and the retention and hiring issues that we have, and general fears of, can we continue to do this forever? This is the time to just put, stick your toe into the water and just discover out of curiosity how I can feel secure and safe in knowing that my practice is still learning, growing, and improving, for all of the reasons, that we've talked about today, because that is fundamentally what's going to get us past the noise and continue to, embrace technology, embrace new clinical skills, and do the kind of dentistry that we all want to do. Because let's not forget, Spear is all about great dentistry. And I am of the mindset it's very hard to do great dentistry without a great business backing it up. And so the 1-2 punch is what we're really trying to achieve here.
Yeah, it's very exciting. Well, Dan, thank you so much for your time. And Amy, just very exciting things on the horizon with Navigator and all the great things you guys are working on in Spear Education. So thanks everybody for watching. More to come as you can continue to watch a lot of the exciting things that are going on at Spear. So thank you to the both of you.
Thank you, guys. Bye-bye.